Hi, my name is Alexis Rawlings. I'm from Atlanta, Georgia. I'm a junior attending Alabama A&M University, and my major is animal biohealth science. On a scale from 1 to 10, how many of you knew there was more than one strand associated with canine parvovirus? Canine parvovirus type 2 has become well known. Stated in Canine Parvovirus Current Perspective by S. Nandi and Manoj Kumar, CPV2 is the causative agent of acute hemorrhagic enteritis and has been considered to be the most effective pathogen in domestic and wild candids and has spread worldwide since its emergence in 1978. Another journal article written July 11, 2016 by Matthias Malonkis, Iris Callie, and Timoleon Rallis called Canine Parvoviral Enteritis, an update on the clinical diagnosis, treatment, and prevention. Mentioned canine parvovirus type 2 being the ground warrant for an extremely contagious acute enteritis that has a high mortality rate and a low survival rate for pets that go untreated. There are many factors accompanied with parvo, so I'll start with the causes. Not being vaccinated is the number one cause. Another cause is coming in contact with another infected dog or puppy. And parvo is usually transmitted through bodily fluids such as feces or vomit, as well as indirect contact. And when I say indirect contact, I mean if you're around a parvo dog and you're loving them, oh, so cute, and then you go back to a pet that has not been vaccinated, then more than likely that pet will have parvo. Some of the symptoms of parvo are bloody diarrhea, vomiting, fever, lethargy, anorexia, weight loss, weakness due to lack of appetite, and dehydration. In a citation used earlier from Canine Parvoviral Enteritis, an update on the clinical diagnosis, treatment, and prevention, they also mentioned parvo having similar clinical symptoms with other acute gastroenteritis disruptions such as HGE, hemorrhagic gastroenteritis. Luckily, parvo is something that can be treated, and parvo is treatable, but it can be a bit expensive. Typically, parvo treatment can cost anywhere from $2,000 and up. It can even get up to $10,000 depending on how late you wait to take your baby to the hospital. But this cost includes hospitalization, medications, feed, monitoring, etc. When parvo patients are admitted, a catheter is placed, which is also included in the cost of the medical bill, and the pet is typically taken straight to isolation where they will remain for the duration of their time at the hospital due to parvo being so contagious. Parvo can take anywhere from 3 days to 2 weeks to be cured, depending on how early or how late it was caught. And in being a veterinary assistant or a vet technician or anybody dealing with parvo, typically you want to take certain precautions when dealing with parvo as well as other pets. For example, when going into a parvo room, you definitely want to make sure that you glove up and you have your gown on. And before exiting, you want to make sure you take all of that off and put it in one trash can and take the entire trash can out. You definitely don't want to dispose in other trash cans that could contaminate other pets. And parvo can be prevented, actually. Canine parvovirus type 2C identified from an outbreak of severe gastroenteritis in a litter in Sweden by David Sutton, Jacqueline Pierce, and Neil Greenland, and a couple other authors did an experiment to test puppies for parvo. The puppies were tested via fecal samples, which is typically how most parvo tests are tested, which is typically how most parvo patients are tested. And the results were positive, but it wasn't for the strain of parvo that they were recently injected with. The strain was CPV2, canine parvovirus 2. And I'm going to show you a quick video on how the treatment of parvo typically goes.
The canine parvovirus infection is a highly contagious viral illness that affects dogs. It manifests itself in two forms: the more common intestinal form, which affects the stomach and digestive system, and the rare cardiac form, which affects the heart muscles. The majority of parvovirus infections are seen in puppies between 6 weeks and 6 months of age. The virus is spread through direct contact with an infected dog. Because the virus is also heavily concentrated in the fecal matter of infected dogs, canines that come into contact with an infected dog's stool may contract the disease. Certain dog breeds such as Rottweilers, Doberman Pinschers, Pit Bulls, Labrador Retrievers, German Shepherds, and English Springer Spaniels are particularly vulnerable to the disease. Symptoms of the intestinal form of the disease include severe bloody diarrhea, lethargy, anorexia, fever, vomiting, and severe weight loss. The virus also affects the dog's ability to absorb nutrients, so infected dogs will quickly become dehydrated and weak. Rapid heartbeat, abdominal pain or discomfort, and low body temperature are also symptoms of canine parvovirus infection. There is no cure for the virus, but veterinarians can treat symptoms of the infection. Hospitalization is often required, and treatments may include intravenous fluid and nutrition therapy, medications to curb vomiting, and antibiotics and antiviral medications. The survival rate of dogs diagnosed with canine parvovirus is about 70% with veterinary intervention. Puppies are more susceptible to death due to their less developed immune systems. Vaccinations against parvovirus are readily available, and puppies should be vaccinated at least 6, 9, and 12 weeks. High-risk breeds may require a longer initial vaccination period of up to 22 weeks. Dogs should not be socialized with unvaccinated or unfamiliar dogs until at least 2 weeks after their final vaccinations.
As mentioned in the video, parvo is treatable, but there are also ways to prevent it. The number one way to prevent your puppy from getting parvo is vaccination. Every puppy is supposed to get vaccinated every 3 weeks, starting at 6 weeks, and they're supposed to get 4 sets. The first set includes a Bordetella and a dewormer. The second set is the first set is a distemper and a dewormer, and distemper is the vaccine that fights off parvo. The second set is distemper and Bordetella and a dewormer. The third set is distemper and Bordetella, and the fourth set is a rabies. So at the end of all 4 sets, your baby should have had 4 distempers, 2 Bordetellas, and a rabies vaccine. But the rabies vaccine doesn't come until the baby is 16 weeks. Now, if you do vaccinate your baby before 6 weeks, there is a chance that your baby could still get parvo because vaccines are ineffective prior to 6 weeks because the puppy's immune system isn't developed enough to handle it. Another way to prevent your baby from getting parvo is to limit social activities with unvaccinated dogs. I know it might sound a little weird to ask somebody, hey, is your pet vaccinated? But you definitely want to do it for the safety of your baby as well as your pockets. And as well as once your baby is treated for parvo and is doing much better, you definitely want to take care of your home prior to bringing your baby home. So anything that can be washed and bleached, I would definitely wash it and bleach it. I recommend shampooing your carpet and throwing away any toys, or at least giving them a good wash, just to make sure that the bacteria isn't still lingering around. Of course, now it's not likely that your baby will get parvo twice, but there are always its chances. And I would definitely get your baby vaccinated after your follow-up appointment to make sure that everything is going well. One thing that I found interesting while doing this research was the relationship between other diseases and parvo. One being multiple sclerosis, a disease that causes the immune system to chew at the protective layer of nerves. A study was done to cognize the correlation between multiple sclerosis and parvo. The data proposes the exposure to parvo increases the risk of MS with one or more environmental impacts prior to adolescence, which was shown in canine distemper virus and multiple sclerosis, written by Matthew J. Hodge and Christina Wolfson. This was infatuating because I didn't think there was relevance between the two. Although parvo is very fatal, it can be treated as mentioned before. Working in a clinic, one of the most frequent questions was, can it be treated, and do certain breeds give parvo more than other breeds? Research approved by the University of Nottingham School of Veterinary Medicine and Science Ethical Review Committee showed non-indigenous breeds, such as bull mastiffs, composed 92% of their cases tested, which means non-indigenous breeds are more susceptible to parvo, which was also mentioned in the video from earlier in the presentation. And this was proven by canine parvovirus CPV2 variant circulating in Nigerian dogs by T.T. Apa, J.M. Dolly, and R.E. Tarleton. To wrap up everything discussed, CPV is nothing to play with. If any of these symptoms are shown by your pet, I will go to the vet immediately. And to go in detail about the PowerPoint, from symptoms, these are both parvo patients, and the bodily fluid next to this patient is diarrhea. And then to conclude, I want to discuss a couple of survivors. This is a black lab. His name is Buddy, and he is a rescue, and he survived parvo. And then next to him is Kunzite, which is the dog that the father is laying his hand on. She survived parvo over 10 years ago, and she is still living a healthy life. So I just wanted to go and show you that your baby can live as well as long as she or he is treated. Thank you.